So here's another question that's specifically directed to Andrea. What options or measures are there to measure the effectiveness of the opioid in controlling pain, and particularly as it affects other medications, for example, dosage levels, and how much is enough to be effective?
Yeah, that's a very good question. We call this opioid effectiveness.
It comes from an excellent source. We have a couple of retired academics in the room.
We call this opioid effectiveness in the guideline. So how do we know how much is too much? How do we know when to stop increasing the dose? How do we know that it's being effective? So opioids are pain medications. So they are meant to release your pain, to relieve the pain. So when you take a medication that is supposed to decrease your pain, you expect that your pain goes down. But in some patients, they say it goes down just a little bit. How much is a little bit? It takes the edge off. And then how much is that takes the edge off? So we use scales. We ask the patients to measure, to tell us how much was your pain before. So before they had this medication, they say, let's say, my pain was 9 out of 10. Then when you take the medication, how much is it now? So then the pain is now, let's say, 5 out of 10. So then you can calculate and see how much is improved. And you tell the patient, okay, so it's doing good for you, but what are you doing with your pain that is lower now? So I can walk more, I can do more things at home. Okay, so with this dose of medication, you can do this thing. Let's increase a little bit more to see if you're going to get more pain relief. And then you increase the dose and nothing happens, it's still the same thing. You increase a little bit more and nothing happens. So then you know that that dose that had the pain to a 5 out of 10 was the analgesic effectiveness. You know that that was what that medication can do for this person, because increasing the dose, you're not getting any benefit and more side effects and the potential for more complications, because the complications, as I said before, they are dose dependent. And also the potential for becoming addicted is higher with the higher the dose. So then you know when to stop. The thing is, after a person is on some period with this dose, we call that the person say, you know, now I've been on this dose for many months or weeks, and it's not doing so well as it was doing in the beginning. Did I develop tolerance to the analgesic effects? That's possible because our body develops tolerance, which means if you give the body the same dose every day, then your body will require more. So then how do we know if we should be going more, higher and higher and higher? So that's why in the guideline, we recommended, it was not me, it was a national panel of 49 people, Dr. Buckley was among these 49 people. They came with a consensus that for chronic non-cancer pain, we should be thinking of a 200 milligrams of morphine equivalent a day. So we calculate all the opioids that you are receiving during the day, and we calculate this in morphine equivalents. So if you're taking a medication that is not morphine, we have to calculate how much that would be if you were taking morphine. So the 200 milligrams is what we call a watchful dose. It doesn't mean a maximum dose, it doesn't mean that you cannot go beyond. It's a watchful dose, meaning that people who have chronic non-cancer pain and they are above the 200 morphine equivalent a day, they should be watched more closely. The follow-ups should be more frequent. We should be doing even some, in my case, I do for my patients who are on those doses, I do sleep studies once a year. I send them to a specialist to see if they're not developing hypogonadism, which is the sex hormones that are lowering, because now we know that when the sex hormones are low, the person may also develop risk of fractures. So I don't want to put my patients on risk, but I know that some patients will need to go beyond the 200 milligrams of morphine equivalent. So we need to know exactly what is the balance. Okay?
Hope that's helpful. It's a complicated question, and I think that's the most reasonable answer I've heard in a long time. So.